Hey there, I'm Madison Splan. I'm a women's clinical specialist through the American Physical Therapy Association and work for Mountainland Physical Therapy. Today, I'm going to show you some exercises to perform if you know that you have a diastasis postpartum. So a couple do's and don'ts to start off with. If you can tell that your belly button is separated or it begins to tent when you sit up, you want to avoid any exercises that you notice that diastasis occurring with. You do not want to sit up directly out of bed. Also, what you want to think of doing when you're lifting baby or anything difficult, try and just suck your belly button in by engaging your lower core muscles that can prevent that diastasis from poking out. So to start off, let me demonstrate a few exercises just to start off with if you know that you have a diastasis. So what we're looking for is engagement of our lower core, which is called our transverse abdominis. We are trying to avoid activation of our rectus abdominis, or those washboard muscles that we don't want to engage. So what you'll do to start off is you will lay on your back. When you lie down, you can tell that there is just the smallest arch in your back. What you want to do is roll your pelvis backwards to flatten that arch. Now, next what you want to do is put your hands on your belly, your thumbs right around your belly button, and your fingers a little bit lower near your pubic bone. What you want to feel when you're activating properly is the muscles near your fingers should tighten and squeeze. However, near your thumbs, you don't want these to bulge. So now what you'll do, now that your back is flat and your pelvis is rotated backwards, you will look up towards the ceiling and you will lift your head up just enough to feel the muscles tighten underneath your fingers, but not too much for where you're gonna bulge. Now notice how I'm lifting up and not crunching forward. That is very important. You want to be lifting up. And it's a very, very small motion that you will feel in order to engage the proper muscles and not engage the improper muscles. The next exercise that we'll do is called the bird dog. Many individuals that have performed yoga might be familiar with this. What you'll do is you'll start on hands and knees. With this exercise, you want to suck in your belly button and draw it up towards your spine. The key with this exercise is to keep your back flat. What you will do is lift opposite leg and opposite arm, sucking in that belly button, holding for 5 seconds. Then you will alternate. And again, keeping your belly button sucked in, lifting opposite arm and opposite leg while pretending there's a tray on your back and maintaining it nice and flat. Here's an example of what it shouldn't look like. Now, here are some exercises that you can do to start off healing of your diastasis. And please visit www.mlrehab.com to find a location with a specialist near you. Thanks.